Good evening, everybody. I'm Dr. Siva Selvan, a senior house officer working in the Department of Gastroenterology in the Queen Elizabeth Hospital, King's Lynn NHS Foundation Trust. I'm here to present my poster on Hemospray, which is an essential tool in the armamentarium. UGI hemorrhage is a common presentation to the emergency department. Acute UGI bleeding accounts to about 84 to 172 per 100,000 of population per year. There are different modalities that we undertake during an endoscopic intervention, including adrenaline injection, endoclip, gold probe application, and hemospray. Hemospray is an inert powder developed for endoscopic hemostasis. We did a retrospective study looking at 20 patients that we admitted between March 2018 and December 2020, wherein hemospray was used. This included patients with upper GI hemorrhage undergoing endoscopic intervention with hemospray when primary modality with adrenaline injection, endoclip or gold probe application failed to achieve hemostasis. The main objective of the study is to aim to appraise the outcomes of UGI hemorrhage where hemospray was used during initial endoscopic therapeutic intervention, and also to see how effective it was as a therapeutic intervention in patients presenting to hospital with upper GI hemorrhage. We also analyzed the demographics and outcome measures relating to the procedures, anatomical site of intervention, rebleeding, and 30-day mortality. Looking at the results, the cohort, as I said, consisted of 20 patients, wherein 14 were male, accounting to 70%, and 30% were female, with 6 patients. When we looked at the site of UGI hemorrhage and where the intervention was done, duodenum accounted for about 70%, with 14 patients having lesion in the duodenum, and 5 patients had lesion in the stomach, accounting to about 25%, and with minimal being esophagus accounting to 5%, and there was just one patient wherein esophagus was the site of intervention of UGI hemorrhage. Looking at the causes of UGI hemorrhage, 12 patients had duodenal ulcers, 2 patients had gastric ulcer, 2 patients had gastric malignancy, while for lesion, metastatic duodenal lesion, angiodysplasia, and reflex esophagitis accounted for 1 patient each. Looking at initial hemostasis achieved with hemospray, 19 out of the 20 patients achieved initial hemostasis, while 1 failed because of massive bleeding and not able to find out the site of bleeding. We looked at the rebleeding following initial hemostasis. With hemospray, it was 15 out of the 19 patients had no signs of rebleeding, which accounted to about 79%. While 4 among the 19 patients had rebleeding at some point, accounting to 21%. In patients who had rebleeding following hemostasis, treatment was with best supportive care, as treatment escalation was considered inappropriate due to comorbidities that the patient had. While looking at the 30-day mortality, there were 7 patients who died, accounting to 35% of the total cohort. And looking into the causes, rebleeding accounted to about 57%, which was 4 among the 7 patients who died, while other medical causes accounted to 43%, and that included 3 patients. Overall, we would like to conclude in a DGS that hemospray has proven to be effective therapeutic intervention in achieving hemostasis in case of severe UGI hemorrhage when other endoscopic therapy failed to stop the bleeding. Thank you and have a good evening.